Thank you so much for sticking with us. Right now, we are chatting with Metro Councilwoman Cassie Chambers Armstrong. Councilwoman Chambers Armstrong represents District 8, which includes the Highlands and the Bardstown Road area. Councilwoman, thank you so much for joining us today.
Thanks for having me.
We have some very important conversations we want to get to, and the first is maternal health care. Louisville faces truly a crisis when it comes to maternal and child care, and you're working on some grant funding so that Metro Council can help with that.
It really is a crisis in our city. So what we see up to 40 women dying per every 100,000 live births, which is a number that's worse than America as a whole, in some cases worse than even the region as a whole. And we know that black women in our city are 2.5 times more likely to die in childbirth than white women. And what keeps sticking with me is the fact that 90% of these deaths are preventable. And so what I've done is take some of my discretionary funding that I have available and say, this is a really big problem. We know how to solve it, and solving it isn't that hard. So organizations, if you're doing this work, come to me. Tell me what you could use this money for to help make sure that women are staying alive whenever they're pregnant and delivering babies, and that they're delivering healthy babies and setting them up for success.
So with that grant, I know there are so many organizations, grassroots organizations that are starting to do this work. What can they do? What can people in the community do if they want to learn more?
So I have a link on my website to learn more about the problem and also find out about this grant funding opportunity. This grant is for $10,000. It's not going to change the situation. It really is a crisis, and it's going to take a lot of policymakers working really hard for a long period of time to move the needle. But this is to get the conversation going. People can also reach out to me. Easy to find me. Send me an email and tell me how you want to engage in this work. I would love to talk to you about the way that you can contribute. We need lots of different organizations and stakeholders at the table.
Yeah. It's a start, and you've got another start in the works when it comes to lead poisoning, something really concerning facing health for children and families.
That's right. So we have had almost 10,000 children in our city be lead poisoned since 2005. And these are children that are facing, in many cases, lifelong disabilities because of their exposure to lead. And again, this is something that we know what we can do to keep kids and families safe. And so we're working with stakeholders trying to figure out how we address this problem in our city.
Absolutely. Councilwoman, such great work. We really appreciate you joining us today to talk about all of those issues. Is there anything else you want to let people know?
The only way we move the needle is if folks engage, and so I thank you all for having me and talking about these really important issues.